In this video, we will do a Q&A about the hypertensive disorders of pregnancy. For the first question, what are the deadly triad of pregnancy? My mnemonic here is HHI, namely hemorrhage, hypertension, and infection, or the so-called deadly triad because they produce the greatest maternal morbidity and mortality in pregnancy. How is hypertension diagnosed in pregnancy? Hypertension is empirically diagnosed as a blood pressure of greater than 140 mm mercury systolic or greater than 90 mm mercury diastolic. Enumerate the hypertensive disorders in pregnancy. First is gestational hypertension. Next is preeclampsia, eclampsia syndrome. Third is chronic hypertension. And fourth is preeclampsia, superimposed on chronic hypertension. What is the most dangerous hypertensive disorder? The most dangerous hypertensive disorder is the preeclampsia, eclampsia syndrome, whether it be occurring alone or superimposed on chronic hypertension. Compare and contrast the four hypertensive disorders. For preeclampsia and gestational hypertension, I group them together because they have similarities. First is they are present in a previously normotensive individual, and that the BP of 140/90 or the hypertensive blood pressure develops after 20 weeks age of gestation. Again, the hypertensive BP develops after 20 weeks AOG, and then it goes back to normal after 12 weeks postpartum. That is for preeclampsia and gestational hypertension. Meanwhile, for chronic hypertension, from the term chronic, it has been present for a long time. So the mother could be a previously hypertensive woman or develop hypertension on or before 20 weeks AOG. But how could we differentiate preeclampsia from gestational hypertension? In gestational hypertension, there is no proteinuria. In preeclampsia, proteinuria may or may not be present. Preeclampsia superimposed on chronic hypertension is the fourth hypertensive disorder in pregnancy. Includes the definition of chronic hypertension, that the hypertension existed before 20 weeks AOG, but with worsening baseline values after 20 weeks. Summary: the deadly triad of pregnancy are the HHI, hemorrhage, hypertension, and infection. How is hypertension diagnosed in pregnancy? It is empirically diagnosed as a BP of greater than 140 systolic or greater than 90 diastolic. What is the most dangerous hypertensive disorder? The answer is preeclampsia, eclampsia syndrome, whether it be occurring alone or superimposed on chronic hypertension. Enumerate the hypertensive disorders in pregnancy. The first two, the preeclampsia, eclampsia syndrome, and gestational hypertension, which occurs after 20 weeks AOG and resolves 12 weeks postpartum. And the third one is the chronic hypertension, which occurs even before 20 weeks AOG. The fourth one is the preeclampsia, eclampsia syndrome superimposed on chronic hypertension, which is a combination of two conditions. Obviously, there is a feature of hypertension even before 20 weeks age of gestation. However, after 20 weeks, there's a worsening of the baseline values. So it's important to monitor the BP before and after 20 weeks AOG. In our next video, we will have an in-depth discussion of preeclampsia.